Hi, a very good morning. So, beginning of the week. So, let's start with our live sessions and we'll continue the same till Saturday. So, every morning at 10:30 a.m. Indian Standard Time. So, today's live session will start with the current events and from tomorrow we'll progress towards case-based discussion. Okay? So, you have the following questions which are not just important just because they are happening currently, but also you can have some academic perspective and you can deal with them in entrance perspective as well. Let's see how we can do that. Okay? So I hope you guys are all ready and see to that you're also maintaining notes simultaneously. So let's start with our first question. Okay? So we have been hearing of this and we have been experiencing the current pandemic. So way back in 1918, there was something called as Spanish flu, even though it's not an accurate term, also called as swine flu or 1918 pandemic, which was caused by H1N1 virus, influenza A type virus. So after the First World War, around 1918, several people died from an influenza pandemic lasting several years. Which of the following changes in virus is responsible for it? Ability to elaborate exotoxins, increased ability to bind with intercellular adhesion molecule 1 receptors, acquisition of antibiotic resistant genes, recombination with RNA segments from pig viruses. So the following are the options you have. Before we proceed with the discussion of this question, you should also understand the fact that this is one of the worst recorded pandemics in human history. As far as we know, there could be even several of such pandemics prior, but this is one of the very recent and worst pandemics which we experienced, which humanity experienced. In 1918, peak during 1918, which affected around 1/3 of world population way back then, which is around 500 million people, killing more than 50 million people. So that was the intensity, and you can imagine how worse the situation is. Even though it's called as Spanish flu, it's not accurate because there is no common consensus like where this virus actually originated. It could be from France, UK, US, China, no general consensus. But it was called as Spanish flu because it's an interesting fact, during First World War, Spain was a neutral country. So the press, press in the sense the newspapers, media and all were free to publish the results. So they reported several incidents and deaths pertaining to this epidemic, mainly in Spain. So the focus was on Spain pertaining to the deaths related to this flu, hence it was called as Spanish flu. But keep that in mind that it hasn't originated from Spain as such. Okay? So, what do you think is a more appropriate answer? For a pandemic to occur to such a drastic extent, which could be the most probable reason in your opinion? Sanjay, this is one of the previous NBD questions. Of course they can. Why should we limit ourselves to only one particular guide or one particular MCQ? Based on current events, of course, you can expect a question. And in fact, in prior years, we have seen that they have been asking WHO theme, World Health theme, and of course, you can expect a question based on current events. Given the importance of the pandemic we're dealing with, given the political and economic, implications it's having, why not? Okay, well tried. So I see most of you choosing a combination of B, C and D, but not A, because you're sure that virus doesn't elaborate exotoxins like bacteria, right? So we can rule out option A. Good. And what about antibiotic resistance genes? Even it's not a property of viruses. It's bacteria which acquire this antibiotic resistant gene, so virus doesn't exhibit these properties. A and C can be ruled out. Increased ability to bind with ICAM1 receptors. For your information, influenza virus doesn't bind with ICAM1 receptors, it's rhinoviruses which bind with these receptors. So option C can be ruled out. So option D is the right answer. So that particular pandemic happened mainly because of the recombination of the viral RNAs with that of RNA sequences of animals, especially pigs. Because of this recombination, there were these new strains which led to this, impact of magnanimity. And there were no vaccines, no cure. It was just, unbelievable, as you can imagine. So recombination with RNA segments from pig viruses, right, leading to, uh, we don't exactly say mutation, but antigenic shift, leading to antigenic shift in influenza A viruses. Because of this antigenic shift, different antigens are being projected, so your body's defense is not effective, any vaccines will not be effective. Just remember the term antigenic shift, which occurred because of the recombination of this influenza virus with that of the RNA segments or RNA sequences from that of the viruses which are found in animals, especially pigs, also called as swine flu virus. If you remember, swine flu virus 1918, just Google out the same. Right? I hope it's clear. Yes. Now, let's move on to the next question. I hope it's clear. The current pandemic is caused by, in fact, one of you were asking me about this in previous live sessions as well. So there is a confusion like, what's the name of the virus? What's the name of the disease? So let's see how much familiar you are with the current trend. Because I've been hearing this day in and out. The current pandemic is caused by, which means you need to identify the name of the virus. SARS-CoV, SARS-CoV-2, MERS-CoV, COVID-19. So which one do you think is the right answer? So is it B, is it D, or is it B and D as Bhavesh mentioned? By the way, let me give you a hint. There is only one right answer. There is only one right option. Okay, well tried, wonderful. So you should understand the fact that in a family there are many relations, just like that. In a family called coronaviruses, there are many members such as SARS-CoV, MERS-CoV, SARS-CoV-2, etc. So these are genetically related, as simple as that. So the current pandemic is caused by a virus called SARS-CoV-2. Severe acute respiratory syndrome, coronavirus 2, right? And the name of the disease is COVID-19. Coronavirus disease 2019, when it first started in Wuhan, as far as we know, as far as the literature suggests. So the name of the virus is SARS-CoV-2. So who does give these names? Let me give you some options. Public, governments, military, all of them, or WHO. So who does give these names? Public, government, military, WHO. I'm sorry, I'm just kidding. It's none of the above. It's none of the above. It's actually given by, can I write here? Yeah. ICTV. Like Instagram TV, IGTV, you have something called as ICTV. See if you can find out what it is. Hi Bernice. Yeah, just as we are discussing now, the name of the virus is SARS-CoV-2, which causes a disease called coronavirus, COVID-19. So the name of the virus is given based on its genetic structure. And why a specific name is given? So that we can develop vaccines, identify the sources of the virus, and also create potential cure. So keeping those aspects in mind, ICTV gives the names. Very good. So as Ria, appreciate your enthusiasm, Ria. International Committee on Taxonomy of Viruses, they do give or name the viruses. Right? So I hope it's clear. And I hope you have no confusion whatsoever. The name of the virus, the name of the disease. And what is the standard reference we have here? WHO website. You can check out WHO website, you will get all authentic information, and do follow the same. Do not follow any other third-party websites. Okay, including this channel. I'm not asking you to follow blindly whatever I say. No, that should never happen. Refer WHO website. Okay? Very good. Yes. Now let's move on to the next question. SARS-CoV-2 isolated from humans are closely related or genetically related to coronaviruses isolated from which of the following animals? Pigs, dogs, cats, bats. So which one do you think is more appropriate? So we discussed about intermediate hosts or the potential source. In fact, the 1918 virus, it was mentioned that it has avian origin. So the zoonotic source of COVID-19 is unknown, as mentioned in WHO website, but the viruses which are found in humans are genetically and closely related to the viruses that are found in which of the following animals? Oh, come on, let's not, let's not pass any negative comments on any country. So it can happen anywhere. It unfortunately happened in one particular place. So let's learn how to deal with it. So most of you are saying it's D because I'm sure you're exposed to a lot of media and a lot of information. So bats is the right answer, belonging to the genus. Can anyone tell me the genus? Okay, so the zoonotic source is unknown, but the viruses found, as I mentioned, are closely and genetically related to those found in this particular genus of bats, Rhinolophus. Okay, so it has been mentioned in WHO website that, as you all know, it originated from one particular place, Wuhan, in China, near Beijing, Wuhan, and in specific from what do you call that, seafood market, Hunan wholesale seafood market, where they usually sell live animals, domesticated animals, or domesticated wild animals. So those could be the potential intermediate hosts. Okay, so that's the information which we have till date. Okay, we need to constantly update because several studies are being done, and we'll see regarding the treatment aspects as well. Okay, we need to keep in touch, and we'll also let you know if at all there are any latest updates. So all you need to do is just keep a tab on WHO website. Okay. Yeah. Now let's move on to the next question. Chloroquine. So one advantage of following news blindly is whether it's true or fake, you'll at least know that there is something, and you'll at least try to answer it. With a lot of confidence, whether it's true or false. Chloroquine is used for treatment of which of the following? So you even heard Donald Trump requesting our Prime Minister Narendra Modi to send hydrochloroquine, a safer derivative of chloroquine. So what is this all about? Chloroquine is used for treatment of malaria, rheumatoid arthritis, extraintestinal amoebiasis, COVID-19. So which one would you choose? Remember, so since we're dealing with entrance perspective, as you know, chloroquine is a drug of choice for chemical cure and suppressive prophylaxis of all types of malaria, except the resistant strains of Plasmodium vivax, as you know, Plasmodium falciparum, as you know. Right, so chemical cure and suppressive prophylaxis of malaria. Also, it has tremendous potential in treating autoimmune diseases, including rheumatoid arthritis, extraintestinal. Along with autoimmune diseases, it's also used for treating extraintestinal amoebiasis. But what about COVID-19? So here and there are few studies which reported its relevance in prophylaxis of this particular disease. Also, if you remember, I've shared some guidelines which are released by ICMR and Ministry of Health and Family Welfare, where they have clearly mentioned that the final recommendation of National Task Force for COVID-19 has given or recommended the use of hydrochloroquine as prophylaxis, and the dosage, contraindications, key considerations, indications, everything has been mentioned in that particular PDF. I'm not asking you to take this medication. There are potential complications and adverse effects as well. I recommend all of you to visit the Ministry of Health and Family Welfare website or go through the PDF which I shared a couple of weeks before. Okay. After the end of this session, I'll again share this and see how relevant and useful for you. So here it's clearly mentioned that in case of asymptomatic healthcare workers involved in care of suspected or confirmed cases of COVID-19, 400 milligrams twice a day on day 1, followed by 400 milligrams once weekly for next 7 weeks to be taken with meals. And also there are few more doses which are mentioned. So just check it and see if it helps you out. And I'm sure it helps you out in preparation perspective. Okay, not for you to take it as such. And also it has several complications as we discussed in one of the assignments. It can lead to blindness. It has toxicity. It interacts with various drugs. Hypersensitivity reactions can be seen. So it should not be taken unless until it is prescribed by a registered medical practitioner. So there are some key considerations. So be proactive and go through the same. I'll again share that information after this live session. Okay? Good. So as of now, it's A, B, and C. D, we have to wait and see. We need further information pertaining to that, but there has been promising results. Okay? That at least to keep in mind. Yeah, or else Donald Trump wouldn't speak that way. Okay, final question. The first choice drug in filariasis, which is known to inhibit SARS-CoV-2 in vitro. Albendazole, mebendazole, ivermectin, metronidazole. So, in the past few days, we have been hearing about a drug which is used for treating parasitic infections, which has a significant and potential role in, killing this particular virus or denaturing or disintegrating this particular virus in vitro. So which is a more appropriate answer? Yes, very good. Ivermectin. So ivermectin, I also share a study related to the same which is published in a journal very recently, Antiviral Research. So on April 3rd, 2020, it was published and it's clearly mentioned that, remember, ivermectin is also the first choice drug in filariasis. So also keep that in mind. So the first choice drug in filariasis, that itself is a hint, which is also known to inhibit SARS-CoV-2 in vitro. So it's not in vivo yet, in vitro, within 48 hours. So the study says that ivermectin is an inhibitor of COVID-19 causative virus, that is SARS-CoV-2 in vitro. A single treatment is able to affect 5,000-fold reduction in viral load at 48 hours in cell culture, and ivermectin is FDA approved for parasitic infections and therefore has a potential for repurposing. Ivermectin is widely available due to its inclusion on the WHO model list of essential medicines. I'll share these key highlights as well in the group. Okay, so these are some of the topics which I wanted to highlight in this specific video. So this is very latest and there is still ongoing research. In vivo studies are yet to be done and results yet to be evaluated. Okay, well done everyone. So we will have a summary of all that we have discussed so far and then we'll conclude the session, right? So we've been discussing about the swine flu 1918 pandemic, the worst which we have seen in the very recent history. It's because of recombination with RNA segments from pig viruses leading to such pandemics. If at all, remember, most important, if at all there are any mutations in the envelope of the virus, there can be epidemics. Because of mutations, the virus will evade host antibodies. So keep this in mind, right? And the current pandemic is caused by, so no confusion whatsoever, we are calling it as COVID-19 virus, which is not accurate. Just like how we say AIDS virus. AIDS is not a virus. AIDS is caused by HIV, and AIDS is a pathology. It's a syndrome, isn't it? So likewise, COVID-19 disease is the name of a disease, and SARS-CoV-2 is the name of a virus which causes the same. And all of them belong to the same family, coronavirus. And you should also know that SARS was first identified in 2003, and MERS very recent, in the sense Middle East 2012. Okay, years are not important, but for you to have an idea. Okay, now moving on to the next one. So you should know that even though zoonotic cause is currently unknown, there has been a very close relation between the viruses identified in man to that of viruses identified in bats, genus Rhinolophus. And chloroquine is used for treatment of all of the following, but COVID-19, even ICMR, our very own government has given certain guidelines on its prophylactic use, so we have to now wait and watch for further information. And the first choice drug in filariasis, which is used or which is known to inhibit SARS-CoV-2 in vitro, is Ivermectin, which is derived from the bacterium Streptomyces evermetelia. I'm not exactly sure of the species name. I think it's Evermetelia if I'm not wrong, right? Streptomyces species. Okay, so just keep this information in mind. And for your questions, like some of you have been asking, like, can there be a question NEET entrance perspective? That's secondary. The primary concern is that we should all be fair as healthcare providers. There is nothing wrong in being familiar with this ongoing research and facts. And the secondary issue is entrance perspective. Yes, of course, you can expect a question in entrance as well. Okay. Right, I hope it's clear, and I hope you found the session informative and you enjoyed the same. And for any further queries or assistance, you can always get back through mail 24/7. So wish you all the best. Love you all, and I'll see you again tomorrow at 10:30 a.m. Indian Standard Time. Take care.